Today we're talking about vitamin B12. It's a really important vitamin. It sounds like an odd number, but that's because they were running out of numbers when they were inventing different vitamins in those days. It was actually discovered in 1926 to cure pernicious anemia. So it is a cobalamin, which means it's based on cobalt. So methylcobalamin, adenosylcobalamin, and hydroxocobalamin. Those are the three kinds of components of vitamin B12 that are really important. Those are the three kinds you need to look for when you purchase vitamin B12. Cyanocobalamin is a synthetic type of vitamin B12, and that is just a chemical, and it can bring your levels up, but it's not really working synergistically in the body. But like I say, those three types of cobalamins should be in your remedy. In addition to that, people need to understand that if you take B12 in, say, a tablet or a capsule and swallow it, you lose about 95% effectiveness. It gets eaten up in the digestive tract. So that's really important to understand, that you're wasting a lot of your money. You need a sublingual type. Sublingual tinctures and vitamins are a liquid in a drop, and you drop it underneath the tongue and you swish it for a few moments. This means it bypasses the digestion, which can burn up the vitamin B12, and actually load it right into the blood supply from underneath the tongue. So that's the way to look at this and to take vitamin B12 and make sure you get the best kind. It has 3 cobalamins included. So in addition to that, we want to discuss the most important thing about vitamin B12. It is the benefits and why we need to have it. So, vitamin B12 is critical for your nerves. It's critical for your red blood cell formation. And as we learned in 1926, it was taken to prevent anemia. On a cellular level, it's actually involved in DNA synthesis, which means if we are lacking of vitamin B12, the DNA will be broken. It won't be reproducing properly. Energy boost and metabolism support is also important, and heart health and homocysteine reduction, that's an important one. It helps manage inflammation, specifically homocysteine. A good thing to understand about the dosing is from a case that I learned about with my own patient. So they were young, and they were an athlete, and they were very active, and they were having tingling in their extremities. So this was a sign that there may be a B12 deficiency, especially since this was a very healthy person. But sometimes people need more of a dose. So the testing showed that the vitamin B12 was normal. But because of the symptoms, I recommended taking a higher dose of vitamin B12. And what happened is they then reduced the symptoms. So that was perfect. So what I want to do is explain to everyone it depends on your own condition, your own body, and different things. So keep an eye on that. So vitamin B12 is critical, especially for the nerves. So when we mentioned before about homocysteine, it's always good to test both of those, because vitamin B12 is a regulator of homocysteine. If your vitamin B12 is down, your inflammation marker, homocysteine, could be high, and all you need to do is increase your vitamin B12. So those are some of the main benefits, and there are some additional very specific benefits of vitamin B12 that are not commonly known. So for example, one is helps with hearing loss, and that makes sense because it's about nerves, and the nerves in the ears are very delicate. It prevents macular degeneration. That's really important. Macular degeneration is where part of the eye is actually degenerating. Remember, in our eyes, we have the smallest, most fragile vessels in our whole body. So the nerves in the vessels are tiny and delicate. So this is important to keep that very strong. So the vitamin B12 for macular degeneration. It's also important for bone density, which is critical as we get older. So other things, just as a quick aside, for bone density, vitamin B12, of course, silica, vitamin D3, and K2, just as a quick tip to understand all the different things you need to do, and of course other minerals such as selenium, strontium, and boron, those types of things. But getting back to B12, focus on getting plenty of B12. It's also good for cognitive function as well. Additionally, it has been known to reduce depression. So that makes sense. If the quality of our nerves, which is basically the bioelectrical communication, is not working properly, in many parts of our body will start to degrade or basically atrophy. So we want to make sure we have plenty of vitamin D. It should be sublingual. It should have all three parts: hydroxocobalamin, methylcobalamin, and adenosylcobalamin. Those three. It should have those three, as they say, sublingual, so it will go right into the blood system. And importantly, if, for example, you're having neuropathy symptoms unexpectedly, and there's no other reason, you would want to increase the dose. It's totally safe. And you can get your levels checked, but it is totally safe. So remember, vitamin B12 is not a real vitamin. It's from the bacteria. If you're plant-based, check your vitamin B12 levels. Even if you're not, check your vitamin B12 levels, because there may be other interference or problems in the source of your B12 itself, but everybody needs vitamin B12. Don't forget, get your tests. Thank you.